We'll next transition to our final presentation for day one of our poster session, and the title is Patient and Provider Perspectives on Geriatric Weight Management in the Community. And the lead author is Elise Kahn. Elise, the floor is yours, please.
Hi, thank you, Dr. Young. Let me share my screen really quick. Okay. Yeah, so I'm Elise Kahn. I'm a third-year medical student at the Medical College of Wisconsin, the Milwaukee campus. So just a little bit of background on this project. So both the number of people over the age of 65 continue to steadily rise in the US. From a systems perspective, both of these things contribute to increased health services. And additionally, obesity has been linked to several leading causes of death in this population of people over the age of 65. So in order to avoid future strain on our health system, it's important that we gather an understanding from elderly patients themselves on what influences their weight. And in doing so, we can help develop a model to better support patients in a clinical environment. So this project was a qualitative interview-based study consisting of 2 phases of interviews. The first phase was with patients over the age of 60, and there was 14 interviews conducted. And then the second phase was with providers caring for that population, and there were 12 interviews conducted there. So interviews remained open-ended and allowed participants to tell their stories. The interviews were analyzed using the using grounded theory approach. So they were coded based on their made themes, and new themes were only added once they appeared in an interview. And then our coding list stopped growing when no new themes emerged. So the coding lists can be broken down into a few different ways. So shown here is broken down into patient perspective and provider perspective. So patients discussed how many things were amplified with their age, including the impact that weight had on their health, as well as mobility barriers and financial barriers. So these 2 quotes really highlight that. One person said, "My mind feels motivated, but my body doesn't." And then another person said, "I have a lot of back pain, and I know a lot of it is due to my weight. And I would feel better if I would lose some weight. I also have high blood pressure and cholesterol, so losing weight would help with that too." Also, a lot of patients discussed the social context of weight, so the importance of social support versus social pressure, like eating out for meals or food as a means of socialization, as well as the way that a person was raised, their lifelong habits had a big influence on their perspectives and their current weight status. So then shifting to provider perspectives, so when asked to compare elderly patients to younger patients, many providers felt that the ease of conversation was much easier with older patients. And this quote kind of attests to that. So if I'm talking with someone younger, they might not have been as impacted as negatively. So it's a lot of nebulous talk about the future. Now the future is here for my patients, so they see firsthand what their weight has done to their bodies and the amount of medicines they have to be taking. So the context of the conversation makes a lot more sense. Despite that, it's very difficult to break habits when someone has had them for their entire life. So there's a lot of discussion on the purpose of weight loss in this population, in particular, the focus on preventing chronic disease versus maintaining function. And many times the focus is towards the latter. And so that leads to a lot of risk-benefit ratios and kind of analyzing the purpose and the benefits of weight loss, and if there are benefits of weight loss if someone is able to maintain their functional status. And then also just the tools that people used, different behavioral, medical, and surgery techniques. So overall, there were just a lot of heightened barriers for this population. Some of them I already touched on, but long-term habits, and then different levels of motivation, short appointment times made it difficult for providers. And some people used an interprofessional approach to combat this. But then also from a systemic perspective, there was a lot of insurance barriers. So as you can see, one person said, the medications we use are very expensive and they aren't always a covered benefit. And that applies to nutrition and behavioral counseling as well. And then also caregiver burnout, and then just conflicting research on the benefits of weight loss in this population were some more systemic barriers that were faced. And then this is just another way to represent the data. So showing that the central phenomenon here is weight management in the elderly, and then looking at the different strategies to approach it, and then some of the different causal conditions leading to it. Also the contextual situations that have providers choosing different weight loss methods, as well as some barriers that are faced. And all of those lead to several consequences shown there, and those are really the main takeaways of the project. So the big takeaways are the connection between health and weight becomes more salient as someone ages. And so it might be easier to discuss weight with older patients because of this, but it's really important to start this conversation earlier. But because of the different risks associated with it, providers endorse hesitancy to aggressively treat obesity in the elderly, sometimes citing lack of substantial evidence of long-term benefits. So for the future, in terms of like a clinical approach, it's really important to define the purpose of weight loss for the elderly, and that can look like realistic goal setting with your patients, as well as assessing for mobility and the ability to change. And then in addition, overcoming systemic barriers like expanding Medicare coverage for counseling and medications is huge, as well as addressing safety concerns with future research on the benefits of weight loss and clinical trials for medications. So I wanted to thank Dr. Ruffalo for her mentorship and the National Institute of Aging, and for everyone here. And I would happily accept any questions.
Excellent. Thank you so much, Elise. I will ask one question. I apologize in advance. We won't have time for more than one, so we can wrap up the session. But I wonder, from your own perspective, engaging in this work, did you find there were any challenges with the topic overall and how to approach that with participants, or did that seem rather seamless?
I think definitely there were some challenges when I was recruiting for the project, though. People knew what the project was about. So in that sense, it was a bit easier to discuss, but definitely I think discussing weight is a very sensitive topic. And that was something that I really learned from this project, was how to do that with people. And then also a lot of participants mentioned how those conversations in a clinical context are important to like maintain things like empathy and really understanding the difficulties that someone is having.
That's great. Thank you so much. Thanks for the work, and thanks to your faculty mentors in moving this work forward. And again, I think what I've really enjoyed with the presentations today is, again, it just shows the diversity of community engagement and all the ways that we can think about how meaningful this is for the clinical, those that are in clinical practice, those that are in education, those that are in research. Community engagement really can be applied across all of these different areas. So kudos to all of our presenters, their mentors, their community partners for this really important work.